back. It's a normal part of growing older, those fine lines that start showing up on your face, right? Especially across the forehead. But if you don't want to put up with them anymore, joining me now is Lisa Williams from Ultra Smooth Skin, along with her patient, Philip Musial. It's good to see you both. Thanks for being here, Philip. And Philip is here because we're talking about more men are getting Botox treatments. Are you seeing that, Lisa?
I am. I'm seeing more men get procedures. I know the statistics. It was 300,000 procedures in 2007 as opposed to about 100,000 in 2001.
Wow.
So we're seeing a great increase in my practice.
Philip, why did you decide to go in to do the Botox?
You know, my girlfriend's been seeing Lisa, you know, for a while now, and just the confidence that you know that she shows, and you know, I got to try it. You know, she's like, just give it a shot, and it's been an amazing experience. I mean, it's you know, the confidence you feel, and nothing. There was no pain. It was everything that I expected and more. It was pretty awesome.
Let's take a look at your before shot. I think people will be surprised because you were very, very happy with the results. So we have a before shot with Philip there. And Lisa, talk about what you were able to do.
Okay, I've seen Philip for a couple years now, and it always does amazing results with him. One particular, I did some Botox across his forehead, and then that's one particular area. And men usually take a little bit more across here, maybe about 35 units. And then the other area that I did was right here in his nasal brow area, and we did about 30 units in that area. They take more than women usually.
They do? Okay.
Yes, and then around the eyes I did about 30 units. But the nice thing about what I think I did for Philip was, if you look at him now, is that one of his eyes was a little different from the other eyes, so I corrected it quite nicely.
Yeah, that you were amazed that she was able to do that with Botox.
Yeah, you know, it's you know, especially you know, non-surgical procedure, and
Right.
and to get this type of effect and cost effective. I mean, it's amazing.
Once you tell your friends that you've had it done, do you find instead of them go, what? They go, oh, well, maybe I'll try it. I mean, more and more men, because sometimes men, you know, the sun and so forth, they age quicker than they really need to. So are you finding more of your friends are interested in it too?
Absolutely.
Yeah.
You know, when they just see that, you know, you can reverse the clock and feel confident and just, you know, kind of get that bounce in your step again, that, you know, of course they definitely want to give it a shot.
And Lisa, for people who maybe aren't familiar with Botox, it really is no downtime.
There's no downtime. You might have some little bumps on your forehead for about an hour that go away rather quickly. And bruising is minimal. Occasionally that happens, not very often. If somebody's taking aspirin or ibuprofen, they might have a higher risk for bruising. But yeah, there's no downtime. It takes 3 to 10 days to work. So it's a great result, a great outcome at a minimal cost.
That's right. You said that the costs have gone down.
Yeah, it's right now it's $9 a unit in my practice, and so we get a lot of people that way when we reduce the price. And in this down economy, people appreciate that with the financial situation that it is. People like to save money. So.
Sure, absolutely. Talk about the new kind of Botox treatments that are coming out. You mentioned that.
Okay, yes. Medicis, which is the manufacturer of Restylane and Perlane, is coming out with a new product named Relaxin, and that shall possibly be out early next year in 2009, and it's supposed to be possibly lower priced and longer lasting.
What does the typical Botox treatment last for?
Yeah, how long does it last?
Well, you've had it done. Does it vary?
It does vary. I would say, on the average, we tell everybody 3 to 4 months is how long it takes before it wears off. But we do know that with research, that the more you do it, let's say you do it for a year or two, that you don't need to have it done as often. You can space it out a little bit longer, 5 months, 6 months, because you're retraining your muscles and you're not using so much expression anymore.
Gotcha, gotcha. And Happy Camper over here. And
Happy Campers.
Absolutely. Well, you look fantastic. And as Lisa said, she was actually able to help lift the eye a little bit, too, so they evenly match more, which is amazing. Because I don't think most men would want to go through the surgery.
True.
But the Botox, I think you're more likely to do.
You know, once again, guys are just wanting to look good like girls.
Look their best,
yeah.
absolutely. Well, thanks, Philip. Thanks for joining us and telling about your story. Thank you, Lisa, for the information. And if anybody out there wants more information about Botox treatments, you can find Lisa over at ultrasmoothskin.com. There's the phone number right there on your screen. Give them a call and book it today.